Good morning, Growing Bones community. I just wanted to come with part two of our overhead throwing athletes video. Last week, Michelle, she definitely gave some very good pointers and some very good tips around how to maintain our mobility and flexibility and strength for our athletes, but really just wanted to talk about from an orthopedics perspective what we're looking at when we're looking at overhead throwing athletes. And so obviously it's a big category of folks, right? So this is probably the most traditional are going to be your overhead pitchers in baseball, but you also have lacrosse and lots of other activities and where you're doing overhead type throwing exercises, and particularly in any individual, but also in children. There's a lot of forces that go into go into throwing. First, it's amazing that our bodies are coordinated enough to be able to pull off such an activity because it literally comes from our hand, travels through our arm, through the shoulder, our core and our trunk, and through our hips and then out of our feet. It's really one of those activities that goes literally from head to toe, and every stage of the chain is important. And so these activities put extreme forces on both the shoulders and the elbows, just in the fact and the kind of velocity and speed that we're able to put together with some of our elite athletes in throwing. And as a result of doing these activities over and over and over again, a pitcher's body in particular actually responds and adapts to the performance. Their body physically changes to accommodate the type of maneuvers that need to be done to throw a ball at that type of velocity. We've all seen pictures online of pitchers who have their arms cocked back in unreasonable positions because literally their bodies have changed, in both the bones and the ligaments to allow them to do such things. And this is able to help them improve their performance. But it can, of course, also predispose them to injury by being able to do these types of movements, right? So in the shoulder in particular, muscles are the main stabilizers of the shoulder. And most of the other joints around the body, the knees and the hips and the ankles, the ligaments are the major stabilizers, right? So when you sprain your ankle, you're spraining the ligaments. It's really the muscles are sort of secondary, but in the shoulder, the muscles are the main stabilizers, and the muscles are what are responsible for keeping the ball in the socket, and keeping the ball really centered in the socket where it's supposed to be. And I actually think of it as a saucer more than a socket because there's so much more mobility around the shoulder. And so when we think of throwing, there's six real phases to throwing, and the pitchers out there and the throwers out there, they'll know a lot of this. And particularly in pitching, you first have your wind up phase, and then you have your early cocking phase where you're starting to bring the ball back and you're starting to get it behind your head. And then you have the late cocking phase where you're getting to that end of that range of motion of how far you can go back, and you're gonna start going forward, and that's leads into the acceleration phase, which now you're changing direction. All those forces are coming are changing in the direction they're going. You're starting to accelerate the ball, down your line of sight. And then after the ball is coming released, you're decelerating, and then you're following through. And so there's different stages of pitching. There's different stages of throwing that are all of them have different associated problems with them. And so I mention this just because that's one of the things that we look at when we're looking at injuries is when are you having the pain? When are you having the symptoms? At what stage of your throwing is this occurring? Because different stages of throwing will give you different stresses on the body. And so it's really important, and it's been shown that maintaining proper shoulder strength and flexibility will prevent injuries. One of the things that happens when you start to go back so far is that you start losing the ability to go forward. And so making sure that you're working on keeping that flexibility in the shoulder will help to decrease shoulder injuries. The most common cause of injuries are due to overuse and fatigue. And so it's the constant overtime and repetitiveness. And later in the season, as you're going into showcases, as you're performing higher than you normally would perform, that's what tends to predispose to injuries. It can happen as a one-time event, but usually it's that overuse that happens and the fatigue that happens over time. And so um, when when we're sort of talking about, well, why are you having pain in your shoulder? The things that we're looking for in terms of your history or what you're telling us. One, I want to know, have you changed your mechanics recently, right? Have you changed the way you're throwing? Are you throwing differently? Do you have an injury somewhere else that's changing how you have to move now, right? Are you developing a new pitch? Is this something new that's happened? Is this a new style of pitch? Are you trying to increase your speed? Are you trying to throw new curveballs, right? Curveballs in young people generally, especially in the younger kids, is not really recommended just because of the amount of stress that it puts on the joints. Are you developing a new pitch? What are your pitch counts? Who's keeping track of them? Little League in particular is very strict about their pitch counts and at what ages you should be pitching and what period of rest you should have. And that's based on literature and research about minimizing injury. So who's keeping track of it and how tightly are they regulating that? And then, as I mentioned, what phase is the pain in of your throwing? And then, as and the other injuries that you may have. So just looking at the shoulder and some common shoulder things. The first thing I'll mention is, when we're thinking about skeletally immature patients who are still growing, they still have growth plates that are open. And so those growth plates are sites of weakness. And so one of the things that can happen is called a little league shoulder. And it really is, we call it, that is what it's called, because it tends to happen in little leaguers and young people and not in adults. And really, this is an overuse injury in skeletally immature patients. It's caused by repetitive stress over and over again, and it tends to happen in the late cocking phase. So when you're at that extreme range of motion, that's usually when you start having pain, sort of in the front of the shoulder. Um, Often it will present in between 11 and 16 years old, but really sort of focusing down. I'd say 13 to 14-year-old is sort of the time where we see a lot of this type of injury. So not a super young child. Um, it tends to be related to your mechanics and how much you're throwing and how hard you're throwing and the rest in between. And so typically it's progressively worsening in the upper arm. So it's not something that happens all of a sudden. It's increasing pain over time or decreasing velocity, so you can't throw as hard as you used to. Um, and and well, how do we treat it? Well, because this is primarily an overuse injury, the treatment really starts with rest, and that's always a hard topic to broach with high performance athletes. But a period of rest. To allow the body to heal. These can actually lead into full fractures of the bone that, of course, limit function quite a bit. And then once the pain has subsided, really focusing on physical therapy for rotator cuff strength, right? And strength around your core, as well as flexibility of the shoulders. So if your shoulder's inflexible, you're going to have greater stresses on your shoulder. And those greater stresses are going to be translated to your bones and to your growth centers. And so really focusing on the flexibility and then the muscles that are stabilizing the shoulder. And so, I think that this is one of the things that we see where patients do not infrequently have these complaints, and it's sort of associated. And then you can also have other injuries, such as tears of muscles and ligaments. So you have your labrum, which is cartilage in the shoulder, as well as rotator cuff injuries, which are the muscles that specifically do control the shoulder, and they're the ones that are responsible as primary stabilizers of the shoulder. And when you have these injuries, you can have focal weakness of the shoulder. You can have pain. You can have limitation of motion, getting your arm above your head or in certain positions. And really, once again, you're focusing on rest, and you're doing a focused physical therapy program for that specific muscle group. And when we do an exam, we're testing those individual muscles for weakness or for injury. And then, of course, if it's a significant injury, we may get an MRI, and if we see an injury, it's uncommon in young people, but you definitely see where you need to do some surgical interventions to address, the findings that you see. Moving on to the elbow. The elbow is the other area of the arm that receives a lot of stress. And you can have pain either on the inside of the elbow or the outside of the elbow. Once again, sort of depends on what phase you're having your pain. It can determine sort of different things that we're looking for. But when you're having pain on the inside of your elbow, it can be the result of a ligament injury. It could be a fracture, a hairline fracture, or an irritation of the growth plate, which is on the inside, very similar to the shoulder, as we just spoke about, or it could be a muscle strain. And so, in terms of the uh, inside of the elbow, the ulnar collateral ligament is the main stabilizer of the elbow, especially in throwing phases. And this is the ligament that is under the most stress when you're really accelerating that ball. And you can either have an injury to the ligament itself, or you can have an injury to the bone in which that ligament anchors. You can have fractures associated with that, and so often these injuries are a chronic, meaning they were there and there's chronic pain, but then there's something acute that happened on top of that. So the athlete usually had some kind of pain that they knew about, but then all of a sudden there was something acute that went on top of that. And many times we're able to treat that with non-operative means, but sometimes operatively we need to address fractures, or even doing a ligament reconstruction if it's severe. And that's the Tommy John surgery that people hear about, and there's other procedures as well, but that's sort of the classic one that people know in the throwing communities. And so you can also have pain on the outside of the elbow, and the pain on the outside of the elbow can result from an injury to the cartilage in the elbow, where the cartilage either gets chipped or gets injured from repetitive stress, and may even break off a piece of cartilage, and that can cause pain. And so you can treat that conservatively or with surgery as well. You can have stress fractures there, tendonitis, and irritating the growth plates there as well. So there's lots of different things that are going on here, but I just want to sort of circle back around to, well, what can we do, right? So what can we do as an athlete? So as an athlete, it really is important that we take care of our bodies, right? It's important that we listen to our bodies. It's important that we stretch regularly, because really your bodies adapt to what we're doing on an ongoing basis. And that by adapting, it's also not doing something else. And so we need to try to maintain that flexibility and that mobility so that we can minimize having injury, right? And so being very diligent about that, being very diligent about how we're strengthening our muscles. And so that's why we provide exercise programs and therapeutic programs that Michelle talked about last week, to sort of say, well, how do you strengthen your shoulder? How do you strengthen your rotator cuff? How do you strengthen those stabilizers around your shoulders so that you can minimize injury, or that if you have an injury, how can we bounce back the fastest, right? And so I hope that this video was helpful to you. We're going to include some links as well of some other resources that I think would be beneficial to you. And we look forward to seeing you the next time, and have a great day.